million people are out of work. The reason we're sending small business owners to jail is that supposedly it is essential to saving an enormous number of lives. Millions will die without it. In the state of New York, though, Governor Andrew Cuomo was unambiguous about why we're doing it. Watch this.
Stay at home. When I issued the stay-at-home order, it wasn't, it would be nice if you did. It is a mandate. Stay at home. If you're a non-essential worker, stay at home. If you leave the house, you're exposing yourself to danger.
Yeah, Cuomo's brother, the CNN anchor, wasn't watching. He was out checking on his second property. But the governor sounded very confident as he said this, and it wasn't just him. We don't want to pick on Andrew Cuomo, future President Cuomo. Every public official pretty much said the same thing. Why were they saying this? What science was it based on? Well, not very much, it turns out. Coronavirus was a new disease that nobody really understood, and of course nobody in history has ever tried a mass quarantine before, so we really didn't know. But we pulled forward anyway. The lockdowns happened. Lives are at stake. Shut up and obey. But today, and you may have missed this, but it's worth knowing about, Governor Cuomo revealed something new and something pretty shocking. New York's coronavirus cases are not coming from those still going to work amid the pandemic, those brave people. They're mostly coming from those who are stuck at home.
This is a surprise. Overwhelmingly, the people were at home. 18% of the people came from nursing homes. Less than 1% came from jail or prison. 2% came from the homeless population. 2% from other congregate facilities. But 66% of the people were at home, which is shocking to us.
First of all, and you got to be honest about it, good for Governor Cuomo for admitting that. That's always the first step. So what do we make of this at home? Well, for all questions like this, invariably we turn to the man who knows, Fox medical expert, Dr. Mark Siegel. Hey, doctor.
Tucker, this is a huge event for public health in New York. New York State looked at 113 hospitals over a 3-day period, and as you just said, they found that 66% of the people who were admitted to hospital were already sheltering at home, were elderly, were unemployed, or retired. 90%, get this, 90%, weren't even walking around. They weren't using public transportation. They weren't using limos. They weren't using taxis. They weren't going out at all. So I want to tell you, from a public health point of view, how they spread this. It's the way we've always felt, what doctors feel, by sneezing, by coughing, by being too close and having symptoms and spreading, not by touching a subway pole. By the way, New York City subway system is being shut down overnight to completely clean and disinfect the subway cars. What's the message here? Governor Cuomo, you originally said May 15th. I have a message for you. Let our people go. Let some of our people get back to work. Transit workers are not spreading this. People at work are not spreading this. I'm not saying open the restaurants. I'm not saying open the bars. Right. I'm not saying open sporting events. But I'm saying working is what our economy needs, and for public health, we can do it. Social distancing. Tucker, areas of New York City, downstate, minority areas, areas where they're not necessarily following social distancing, that's where it's spreading, and that's where the hospitalizations are coming from. But we flattened the curve here. We only had 600 hospitalizations over the past day. It's going way down. I can tell you from my own hospital, going way down. That's flattening the curve. It's time to loosen up, Governor.
I've never understood, and I wish we had more time, but I hope you'll come back and we can explore in some detail why we didn't, at the outset, focus more of our money and attention on the most vulnerable populations, the elderly, for the immunocompromised. Maybe there's a reason for that, but it seems like maybe we should have done that.
We should have. Yes, we should have done that, and that starts with nursing homes, which we didn't pay any attention to, and it's a disgrace. Exactly. And yes, people that were at home and retired and more vulnerable needed our attention first. Absolutely, Tucker.
That's exactly right. Dr. Siegel, thank you so much for joining us tonight.
Thank you.
We've learned a lot of lessons about how our government works and doesn't work over the past couple of months. What have we learned about how the private sector works? A CEO of a pharmaceutical company joins us with an interesting